So can we start? Hi, welcome. Aparna to take over the section.
Good evening all. Myself, I am Aparna. Today we are talking about anatomy and physiology for GNM and based upon some question papers and answers. Okay. Let's talk about
Ma'am,
movement.
some noise is disturbing the
Introduction
class.
to
Ma'am,
anatomy.
can you please tell me others to please mute their mic? Some some noise did not clear, ma'am.
I repeat, please mute all your microphones. Otherwise, this will not be clear. Okay?
നമ്മളെ വൈകെ
Listen, please mute your mic.
അതാ ഓർക്കങ്ങനെ അവൾ തോന്നി മാതിരി പഠിച്ചാ പഠിച്ച് പഠിച്ചില്ല ആ കണ്ടീഷൻ എങ്ങനെ വിടണം കഴിഞ്ഞ ഞങ്ങളുടെ കളി ഗെയിം പോയാൽ നടക്കല്ലോ അതാണ് അത് മറന്നുണ്ടാവും എന്താണ് നമ്പർ ഇല്ല കൊടയും കൊണ്ടുപോകും ഒരു വൈക്കും കൊടയും കൊണ്ടുപോകും അവിടെ കൊടുത്തിട്ടും കാര്യമില്ല എവിടെയെങ്കിലും തെറ്റ് പോയി സ്കൂൾ പോകുമ്പോ പോലെ കൊട കൊണ്ടുപോകില്ല എന്നിട്ട് പോയതാണ് കറക്റ്റ് നിങ്ങൾ സ്കൂളിൽ എടുത്തില്ലേ സ്കൂൾ കുറച്ച് താഴത്താണല്ലോ അവിടെ ഒറ്റത്തിന് അനിയന് അവളൊക്കായി
പറഞ്ഞ അക്കൗണ്ടിൽ മ്യൂട്ട് ചെയ്യോ ഓഡിയോ ഒന്ന് മ്യൂട്ട് ചെയ്യോ
എവിടെയാണ് അപ്പൊ നിങ്ങൾ ഇവരൊക്കെ അത് കുറച്ചും കൂടി വന്നിട്ട് വലത്തോട്ട് തിരിയാണ് അല്ലേ ഇവിടെ നേരെ ഓപ്പോസിറ്റ് അവിടെ അമ്മായിയും മുത്യാപ്പൊക്കെ ചെറാ പറഞ്ഞൊരു വൈക്ക് കുടുംബക്കാരാണ് തോന്നുന്നു മക്കളാണ് നേരത്തെ അമ്മായി ഉണ്ട് ഉമ്മാടി മുത്യാപ്പുണ്ട് അമ്മായി മോളും അത് വാപ്പ വന്ന കുടുംബത്തിൽ പോയാലും
Shafir Shah, please listen. Please mute your mic. Okay? Otherwise, the class will not be very clear.
വളർത്തിപ്പെടാൻ പോകുന്നു ആ രാത്രി ഏതാണല്ലോ
ഷഫീർ ആരാണ് ഒന്ന് മൈക്ക് മ്യൂട്ട് ഇവിടെ ആർക്കും ഒന്നും കേൾക്കുന്നില്ല നിങ്ങളോട് കുറെ നേരമായല്ലോ പറയുന്നേ
കേൾക്കുന്നില്ല? Please mute your mic.
പോയിലെത്തിയിട്ട് ആടിനെ പിന്നെ അടിവാരത്ത്
Please mute your mic.
Hello student,
Please mute your
please mute your mic. Can we start? Are you ready?
Yes, ma'am.
Yes, ma'am.
ആരാ ഇവിടെ വന്നിട്ടാണല്ലോ
Just checking the sister. Please mute your mic.
Hello.
Good evening, all.
Good evening, all.
Myself, I am
Myself,
Aparna.
I am Aparna.
We are talking
We are
about
talking about today one topic is anatomy and physiology for GNM and benefit of BSc student also.
so first
So,
unit is
first unit is
introduction to
introduction to anatomical term
anatomy
organization of
human
the
body.
human body.
So today
So
we will
today we are
discuss about
discuss about the
introduction of
introduction of
anatomical
anatomical term
and
and
human body
human
structures.
body structures.
The
So the
examiner
examiner
asking some
are
questions
asking
for this
some question
chapters.
for this chapters.
Something
Something
what is
what
human
is
body,
human
then
body,
system and
then
cavity
system
of
and
the human
cavity
body
of
like
the
that.
human body like
So
that.
I
So I
explain
explained
some
some
little words.
little words. Okay.
First of all,
First of
the
all,
body
the
organs
body
are
organs are
organized in
organized
one
in
of
one of
two
two
main
main
cavity,
cavity,
like
like
10 cavity is
10
there,
cavities there,
anterior
anterior
and
and
posterior,
posterior,
then
then
superior
superior
and
and
inferior,
inferior,
lateral,
lateral,
medial,
medial,
proximal,
proximal,
distal, and
distal, and
superficial, and
superficial,
final
and
one is
final one
deep.
is deep.
So
So
they will ask
they will
some
ask
one
some
word
one word
question
question
like fill
like
in the
fill in the
blank,
blank, then
short
short
answers like that
answers
they will
like
ask
that they
the
will ask that
examiner. They will ask
examinator they will ask.
list out the
List
cavity
out the
names,
cavity names,
then explain
then
some
explain
cavity.
some cavity. The cavity,
They will give some
they will
cavity
give some
names.
cavities name.
So they will ask
So they will ask explain
cavity,
this cavity,
like
like
dorsal cavity.
dorsal
What is
cavity.
that
What is that
dorsal cavity?
dorsal
So
cavity? So
like that they will
like
ask.
that they will ask.
Then next unit
Then
is
next unit is
introduction to the
introduction to the
detailed structure of
detailed
the body.
structure of the body.
So it is the
So it is the
important
important
unit
unit
in the anatomy
in
and
the anatomy
physiology.
and
They will
physiology. They will
important this unit
important this unit
because they will
because
ask
they will ask
structure of
structure of
human body,
human
then
body,
reproductive
then
and
reproductive
functions.
and functions.
They will ask
They will
some
ask
main
some
question:
main
what is
question:
cells?
what is cells?
The label
The
of cells
label of cells
and
and
the diagram.
the
They will
diagram. They will
ask some
ask some
diagrams, then
diagrams,
tissues,
then
then type
tissues,
of
then
tissues,
type of
then
tissues,
glands,
then
the
glands,
structures
the
and
structures
body
and
cavity.
body
Uh,
cavity. What
what
is
mean by the
what mean
cells?
by the
The
cells? The
cells including
cells
what is
including
there.
what is there.
Actually, the body,
Actually, the body,
the human
the
body is the
human body is the
single structure,
single
but it
structure,
is made
but
up
it
of
is made
cells,
up of
tissues,
cells,
organs, and
tissues,
system.
organs, and
So
system. So
the GNM
the
students,
GNM
they will
students
ask
means
some
they will ask some
for
for
4 mark question
4 mark questions
or short
or
essay
short
questions.
essay
They will
questions.
ask
They will ask
this type of
this
question in
type
these
of question,
chapters.
these chapters.
Then
Then
next unit is
next unit
blood.
is blood. Blood means
Blood is the
blood is the
body fluid
body
in
fluid
the circulatory
in the
system
circulatory
of the
system
human
of the
body.
human
It is
body. It
delivered.
is delivered.
The blood is
The blood
delivered
is
to
delivered
body.
to
The
body.
oxygen
The
supply,
oxygen
nutrition
supply,
supply,
nutrition
everything
supply, everything
they will give in
they
our
will give
body.
in our body.
Blood, they will give
Blood, they
nutrition
will give
supply,
nutrition
oxygen supply.
supply, oxygen supply.
So they will ask
So they will
some
ask some
functions of blood,
functions of
then
blood,
clotting period,
then clotting period,
then filtration of
then
blood,
filtration
then
of
blood
blood, then
grouping.
blood grouping.
So the
So
short essay,
the
they will
short
ask
essay, they will
blood
ask
grouping,
blood
the four
grouping,
mark
the four
questions,
mark questions
asking
asking
this chapter.
this
And
chapter. And
next unit,
next unit,
mm, the
mm,
circulatory
the
system.
circulatory system.
The main
The main
important chapter, the
important chapter,
circulatory
the
system.
circulatory
The
system.
heart,
The heart, heart
structure and
structure
functioning of
and
heart.
functioning of
Then
heart. Then they will
the exam
the
time they will
exam
ask
time they will
structure
ask
of heart
structure of
and
heart
diagram of
and
heart.
diagram of heart.
So I will
So
show one
I will show
picture
one picture
in
in
heart.
heart.
So this is the
So this is the
picture of
picture
heart.
of heart.
The exam time
The
they will
exam
ask
time they will ask
label of heart
label of heart
and
and
structure and
structure
explain
and
everything, the
explain
functions of
everything, the
heart.
functions of heart.
I will share
I will
one
share one
video.
video. Okay.
This is the
This is the
video,
video,
heart pumping.
heart pumping. Okay.
This is the
This
video
is
of
the
heart
video of
pumping.
heart pumping.
Uh,
Uh,
it
it
help
it
of
help of
blood vessels
blood
and
vessels
types,
and types,
structure,
structure,
position,
position,
circulation of
circulation
blood,
of
and
blood, and
final one is
final one
blood
is
pressure
blood
and
pressure and
pulse.
pulse.
So
So
the
the
heart means
heart
they
means
will made
they
up
will
of
made
so
upon
much of
so much of
vessels
vessels
and
and
cells, then
cells, then
iota,
iota,
everything.
everything.
Okay,
Okay,
so they will
so they
ask
will ask
some
some
questions for
questions
a
for
long essay
long essay
in this
in
chapter,
this
that
chapter, that
circulatory system.
circulatory
The
system.
next
The
topic
next
is
topic
the
is the
lymphatic system.
lymphatic
The
system.
lymphatic
The
system,
lymphatic system,
they ask
they
structure
ask
and
structure
functions of
and
lymphatic
functions of
cells
lymph
and
cells and
lymph node nodes and
nodes and
circulation and tissues,
circulation and
spleen and
tissues, spleen
thymus.
and thymus.
I will share
I
some
will share
videos.
some videos.
Let's see.
Just see.
The next
The
unit
next
is
unit,
respiratory system.
respiratory system.
Respiratory system
Respiratory
also
system
the
also
important
the important
topic.
topic.
So they'll ask
So they'll ask
structures and
structures
functions of
and functions of
respiratory organs,
respiratory organs,
the physiology
the
of respiration,
physiology of respiration,
characteristics of
characteristics of
inhalation and
inhalation
exhalation.
and
So
exhalation.
I will
So I
show some
will
videos,
show some
inhalation,
videos,
exhalation.
inhalation and exhalation.
The first one is
The first one is
inhalation.
inhalation.
The second one is
The second one
exhalation.
is exhalation.
The next
The
unit,
next unit,
digestive system.
digestive system.
The digestive
The
system
digestive system
is structures
is
of
structures of
functions, the
functions, the
stomach and
stomach
the
and
type of
the type of
what is it?
what is that,
Duodenum, then
duodenum, then
shape of
shape of
stomach. They'll ask
stomach.
some
They'll ask some
one word questions
one word
or
questions
two mark
or
questions.
2 mark
They'll ask
questions. They
these
will ask
chapters.
these chapters.
So this
So
is the
this
structure
is
of
the
stomach.
structure of stomach.
This is a diagram of
This is a
stomach.
diagram of stomach.
Next chapter is
Next chapter
excretion
is
system.
excretion system.
Excretion system is
Excretion
the
system means
kidney
the
function.
kidney
So,
functioning.
like
So,
other name is
like
renal
other name
function
is
system.
renal function
So
system.
structures
So
of
structures
functions
of
of
functions
kidney,
of kidney,
urethra, urinary
urethra,
bladder,
urinary
and
bladder, and
like
like
kidney functions.
kidney functions.
So
So
they will ask
they will ask
some
some, what is
structure
that,
of kidney,
structure of
then label
kidney,
it.
then
Minimum
label it.
4 label
Minimum
is must
4 label is must,
because
because
four mark question
four
means
mark
they will
question means they will
label it four
label it
parts,
4
then
parts,
explain it.
then
So
explain
they
it.
we are
So
getting 4
we are
mark,
getting
that full
4 mark,
mark they
that
will
full mark they will get.
then
Then
next chapter is
next chapter
endocrine
is
system.
endocrine system.
The endocrine
The
system
endocrine system,
we are discuss
we are
about
discuss about
pituitary gland
pituitary
and
gland
thyroid
and
gland,
thyroid
then
gland, then
pancreatic,
pancreatic,
parathyroid, adrenal
parathyroid,
gland,
adrenal gland,
pancreases, ovaries,
pancreases,
and testes.
ovaries, and testes.
So they'll
So
ask
they'll ask
some
some
10 mark question or
10 mark
5
question
mark
or
question.
5 mark
What is
question.
thyroid
What is
or
the
what is
thyroid or what
parathyroid?
is parathyroid?
Then adrenal, then
Then
position of
adrenal, then position
pancreases,
of
then
pancreases,
ovaries,
then
testes.
ovaries, testes.
Some
Some
sometimes they will ask one
sometimes
word
they will
question.
ask one word question.
So sometimes they will
So
ask 5
sometimes they
mark
will
or
ask
10
5
mark
mark or 10 mark
essay.
essay.
The pituitary
The
gland,
pituitary gland, thyroid gland, parathyroid
adrenal
gland,
gland,
adrenal gland,
pancreases,
and
ovaries,
pancreases, ovaries,
everything
testes, everything you
have
should
some knowledge.
have some
What is
knowledge.
that?
What is that?
What any
What
question
any
asking means
question
okay.
asking means okay,
Okay, this is the pancreases
this is the
or this is
pancreases or
thyroid.
this is thyroid.
Mainly the GNM
Mainly
student
the GNM
mainly
student
they will ask
mainly
some
they will ask
diagrams.
some
So many
diagrams.
diagrams they will
So many
ask.
diagrams
The
they will ask.
explanation
The explanation
is must, but
is must, but
diagram is important
diagram is important to
GNM student.
GNM student.
Then next topic
Then
is
next topic is
reproductive system.
reproductive system.
So the first one is
So the first
male
one is
reproductive system,
male
and
reproductive system, and second one is female reproductive system.
so
So
they will
they will
ask one question,
ask one question. Okay,
show some
show some
pictures and
pictures and
dash filling the
dash
blank
filling the
or
blank
like
or
that they will ask.
like that they will
Then
ask.
functions
Then
of
functions of
reproductive system.
reproductive system or male or female reproductive
Then
system.
structures
Then
and
structures
of
and structures of
and
breast
structures and
and
functions of
structures
the
and
male
functions of the
reproductive
male
system.
reproductive system.
Then
Then
like that they will ask.
like that
Okay,
they will
they
ask.
will ask
Okay, they will
fill in
ask
the blank or
filling the blank or
one mark question or
1 mark question or
2 mark question.
2 mark questions.
Then next one is
Then next one is
nervous system.
nervous system.
The nervous
The
system,
nervous
the
system,
type of
the
nerves,
type of
structures
nerves,
and functions,
structures and
the
functions,
brain and
the brain
cranial
and
nerves, then
cranial nerves,
spinal cord
then
and
spinal cord
motor
and
and
motor
sensory
and
pathway
sensory
of the
pathway
spinal
of the
cord,
spinal cord,
autonomic nervous system.
autonomic nervous system.
So,
So,
mm,
mm,
this is the
this is
picture.
the picture.
First one is
First one is
um,
Some technical problems are arrive here. So next section will taken by Mrs. Shruti Joseph. Ma'am, please.
All right. We can again restart from the reproductive system. So in between, if you have any doubt, you just raise your hand. And in the same way, you can write it in the comment box. Definitely, we will check and we will clarify your doubts. In the reproductive system is one of the important students here. Kindly mute your phone. Okay. Thank you. Okay, in the reproductive system, it is very important for both GNM and as well as DSC syllabus. Again, substitute. Kindly unmute. Kindly unmute your mic. Okay, I hope I'm audible. If you can hear my voice, just raise your hand or just put a like. Okay, thank you. We can again continue. In the reproductive system, it is very important. We know that in reproductive system, there is female reproductive system and male reproductive system are there. In both male and female reproductive system, again, it is classified into external reproductive organs, internal reproductive organ, and secondary reproductive organ, especially in the case of female reproductive system. Okay, so as in the revision session, you should just remember about what are the external reproductive organ, what are the internal reproductive organ, and what is the secondary organ. Secondary organ means that is the mammary gland or breast. Okay. Then next is the female reproductive organ. In male reproductive organ also, external reproductive organ is there, internal reproductive organ is there. And in that, you should learn some of the diagram, especially uterus. So this uterus is very, very important. Definitely you will get an essay question or otherwise we can expect a short note question from this session. So structure of the uterus is very important. And when you are drawing a structure for the anatomy, every student can pass the exam because it is very simple when you are learned to draw the diagram. So drawing diagram, maybe it is difficult for some of the students, but we know that everyone know that you are not an artist, you are a medical student, so you just draw the diagram as like it needs some similarities with the organ. Okay, that is enough. And in the same way, you should label at least 4 areas. Okay, so when you are studying about a labeling diagram, you should know, you must familiar to label the diagram at least 4 part. Definitely, it will give a lot of mark. Don't worry about that. So in reproductive system, you should learn about uterus. Okay, I hope it is clear. Then next we can move to the nervous system. That is the next unit in your anatomy and as well as physiology. We know that in GNM, your first paper is bioscience. In bioscience, total 3 subjects are there. Anyone have any idea which are the 3 subjects you have in bioscience? Any idea?
Anatomy, physiology.
Yes. Anatomy, physiology, and one more subject is there, that is microbiology. Exactly right. 3 subjects are there: anatomy, microbiology, and physiology. Yes, correct, correct. Okay, so in that anatomy and physiology together we are learning. So one of the essential unit after this reproduction, that is nervous system. In this nervous system, we know that central nervous system is there, peripheral nervous system is there, a lot of things are there, neuron are there, structure of neuron, everything is important. But we can just focus on which are the important points we need to study from this nervous system because we are focusing on our exam. Okay, I know that from this 1 year you are learned about the anatomy, physiology through your classroom or your clinic skill labs everywhere. But those sessions we are completely focusing on the examination. That is the reason I am talking about the important points. As a nursing students, you should learn everything about the anatomy. That is the better one. Anyway, if knowledge is increasing, means definitely it will helpful for your hospital situation and as well as in other areas. In nervous system, what is important? Nervous system, the structure of the neuron, the third structure. You can see in the screen, the third one, that is the structure of neuron. So mostly you will get a 1 mark question to draw a neat labeled diagram of neuron. Otherwise, a 5 mark question, or you may get like a essay question in this nervous system unit. Next unit, that is talking about the sense organ. What are the sense organ we have? Any idea? What are the sense organ we have? What are the sense organ?
Ear, nose,
Eyes,
tongue.
nose, ear,
Hmm. Yes, correct,
Nose.
five
correct.
sense organs, skin,
Yes,
tongue.
yes. We have different sense organ. So the structure of every sense organ is important. Actually, I think compared with other units, studying the structure of the sense organ, it is little tricky. But don't worry, it is very easier. At least you should learn to draw the diagram and label some of the parts. So most commonly asking one question is that ear. Draw the structure of ear and explain the function. Next time they may be asked about the eyes, but drawing the structure of eye is little bit difficult. So that is the reason most of the cases that during the exam time that will be omitted. Okay, but in some cases we can accept that also. So regarding the sense organ, the function and the structure of the sense organ are very important. Don't forget to learn before going to your examination hall. Next is skeletal system. Skeletal system means what? Skeletal system is talking about our bone. Okay, so skeletal system basically divided into two: axial skeleton and appendicular skeleton. So most commonly asked question is that one word question is there. Otherwise, one filling the blanks question is there. So after this session, we will show one model question paper and we can discuss the answer. In that time also you can see that one. But my question is that in the skeletal system, the frequently asking one question is that how many bones are there in the human body? Anyone have the answer? How many bones are
206.
there?
206.
Any other option? Any other suggestions?
206.
206. Everyone are familiar. Yes, that is a one-word question. Definitely, there is no hesitation in the next examination. You will get a question like that. How many bones are there in the adult body? That is 206. Okay. So, in the skeletal system, learning about the complete human body and the bones are little difficult because their names and their terminologies are little tricky. But how to learn this terminology? How to learn the name of the bones? That is an important question here. So here, basically, for studying the name of particular organs or a particular bone, you should write and learn. Okay, otherwise spelling error will happen. So that is the reason you should write and learn the spelling also. So in the skeletal system, some bones are very important that you can expect in your examination. Okay. So the complete structure you should learn, but it is little difficult. That is the reason from the structure I will select some of the bones and that you should learn. Your most 90% chance is there for get that type of question. First one is structure of skull. Okay, some basic information regarding the skull you should learn. But drawing the structure of skull, that is we couldn't able to expect, but because that is little difficult. The second question is that clavicle. Clavicle means otherwise it is known as beauty bone. Clavicle. Where it is located? Clavicle that you can see here. Clavicle. So clavicle is there. Clavicle, the structure of clavicle, it is important that you can learn that one. Okay, then next structure is scapula. The bone scapula, actually that is placed behind. Okay, behind your ribs. That is a plate-like structure. That scapula bone also little bit important. So don't forget to learn the clavicle, scapula. Next one is sternum. Okay, next bone is sternum. Sternum that is placed where it is located. Sternum. Have you see the sternum in this diagram? Sorry, in the diagram. Sternum. Sternum will protect our heart. Is it? So the structure of sternum is important. And the next one is femur or the thigh bone. That is a long bone. The thigh bone also important. Okay. So in anatomy, which bones are important? Femur is important. Sternum is important. Clavicle is important. And also scapula is important. And the radius ulna, we know that radius and ulna that is present in your arm. That is also you should learn. When you comes to third year, which portions are important in third year? The pelvis is very important, but that is not important in your first year. But in third year, definitely you should learn about the pelvis. Okay, in OBG subject that we can see in the third year. Now that is about the skeletal. Next unit, that is talking about the muscular system. Okay, muscular system means that is about the muscles. Anyone can tell the name of any of the muscles? If you are giving injections for the staff, so
Deltoid muscle. Deltoid muscle.
deltoid muscle. Then try. Ah, yes, gluteal. So who all are going to the gym? They can tell the name of some of the muscles.
Thighs,
Yes, yes, correct.
thighs.
So in yes, correct. In muscular system, that is talking about the muscles. So muscles, including our smooth muscle, cardiac muscle, also it is included in the same like our deltoid, triceps, biceps. The muscles also important, and actually we can expect a 5 mark question from that. Okay, so for a first year GNM student, in your anatomy and physiology portion, you have only this much of units in your anatomy. So once again, we can check with that. The first unit, That is talking about the introduction to anatomical terms and organization of the human body. What is the anatomical terminology? Because up to this GNM course, you are a student and you are studying up to +2. Is it? So up to your PUC, you are completed. Then you are coming to a medical student or a nursing students. You are going to explore a world of anatomy. So in the anatomy, they are using different terminology. So in the session, they are talking about some of the terminology, especially anterior, posterior, superior, inferior. Like that terminology, they are explaining in the unit 1. In this unit, adduction, abduction, okay, flexion, extension. Those points are important. So just remember these terms, that what means. Okay, the meaning of the terms you should remember. It is very simple. Within 10 minutes or 5 minutes, you can cover this unit 1. Next, introduction to detailed structure of the body. Already Avarna ma'am is explaining about the cell is very important in this structure, in this unit, and also tissues are important. Different types of tissues means epithelial tissue, connective tissue, compound, different type of tissues are there. The classification of tissues maybe you will get asked like an essay question in this unit 2, known as introduction to detailed structure of the body. Okay. Next, blood. In the blood, which are the questions we can expect? Functions of the blood. Mostly you will get a 5-mark question. Explain the functions of blood. How can you explain? One by one, you can put the points and write the function. Second is regarding the clotting factors. Okay, different clotting factors we have. The name of the clotting factors you can remember. Okay, I think someone have some doubt. You can, if any doubt means you can ask. Otherwise, mute your microphone. Any doubt means you just raise your hand and ask. Okay. Or write it in the comment section. Next one is the unit 4. Already discussed, so I'm not explaining too much. In the circulatory system, heart, structure of the heart is important. Just to see the structure. Okay. So here, some of the areas. From this today itself, we can learn. Today itself, you can learn what are the structure. Aorta is there. Superior vena cava, inferior vena cava. Inferior vena cava, that blood taken from downward, from the down area of our heart, down area of our body. Then superior vena cava. Then pulmonary artery, pulmonary vein, left atrium, right atrium, left ventricle, right ventricle. It is very easy. Everyone can label this area. The structure of the heart, that is very important. And also 2 valves are there, which are the valve, mitral valve, tricuspid valve. These valves are very important. So remember to label this valve also. Okay, next is lymphatic system. Mainly lymphatic system, what is the function of the lymphatic system? That is providing immunity for our body. Is it? Lymphatic system have a major role to provide immunity in our body. So this lymphatic system and the function for the structure of the thymus and explanation about the thymus, it is maybe important. In the respiratory system, definitely one essay question is there from the respiratory system, that is lungs. So you should learn how to draw and label the structure of lungs. Okay. So, and also here you can see 2 different structures. First one is the structure of the upper respiratory tract. The second one is structure of the alveoli. Actually, this is not a commonly asking question, but you can learn that one. Alveoli, the study about, if you are studying regarding the alveoli, it will help you in your future also, because in second year you will learn about medical surgical nursing. In medical surgical nursing, respiratory system is there. Most of the disorders are related with alveoli. So when they are asking question about alveoli, you should remember, okay, I studied in my first year. So just to remember that alveoli and upper respiratory tract. Don't forget to learn the structure of lungs. In the digestive system, can you guess which organ is very important?
Stomach.
Yes, stomach. Stomach, that is a J-shaped organ. This J-shaped organ, stomach, then the labeling, it is very easy. Okay, the one small notch is there that is known as cardia. Then upper area means the stomach is connected from esophagus and it is connected to the duodenum. Okay, so upper area that is known as fundus, in the middle area known as body. And lesser curvature, greater curvature. You can see there lesser curvature and greater curvature. Just carefully listen this one. So in your examination session, that 3 hours time, if you get a question like this, definitely you can remember this class and you can draw the diagram. Okay, so carefully watch once again, watch the structure of the stomach and read the different part. Esophagus, fundus, cardia, lesser curvature, body, greater curvature, and next duodenum, pyloric sphincter, different areas are there. Just to make a look on that, definitely it will help you. Excretory system also we are discussed. Uh, I think some other is sharing the screen. I will share the screen once again. I will share the screen once again. Archana, okay. In the excretory system, the structure of the kidney, ureters, urinary bladder. Structure of urinary bladder, they are not asked. Ureter is also not asked. But the structure of skin and the kidney, they will ask. Okay. That is a question from excretory system. Endocrine system. What is endocrine system? Endocrine system that include different type of gland. Means pituitary gland, thyroid gland, parathyroid gland, adrenal gland, pancreas, ovaries, testes. From this, 1 5 mark questions you will get. So what? How we can learn that one? How we can learn? Just to remember about pituitary gland and remember the location of pituitary gland. Why pituitary gland is important for our body? Just ask one question. So you will get one answer that you can write as like a definition. Then what are the functions done by pituitary gland in our body? Without pituitary gland, what will happen to us? And that is a question. Then you can find different functions of the pituitary gland. Same like the thyroid, parathyroid, adrenal, pancreas, ovaries, testes. Mostly pituitary gland and thyroid gland, adrenal, pancreas. These four are very important. Okay. Then next, reproductive system. We talk about that. Female, male reproductive system, nervous system, structure of the neuron. Don't forget to learn structure of the brain. You should learn the structure of the brain. In the middle, you can see the diagram. That is the structure of the brain. It is not label, but you should label. Then sense organ, skeleton, and muscular system. Okay, these all are about your units. I hope it is clear and you got a basic idea about the units that you have in your first year anatomy and physiology. Clear?
Yes, madam.
Okay. I saw one question from the comment box. They are asking, "Ma'am, will you take the class in detail?" She said, "Definitely, we can take the class in detail, but it is a limited time, so that is the reason. Just the revision classes we are conducting. If you want, we can take the long classes, no issue. Okay, so that you can just send us like a message. Okay, so basic revision regarding the anatomy portion we are conducted. So next is the most awaited portion. We can just discuss about a question paper. How it is? Want to discuss a question paper? Recently, 2024 question paper we can discuss. Is it right? Okay. Okay. So again, I will show. Oh, sure, sure. Okay. So here I'm going to present my screen. So this is the recent question paper in 2024 January. One exam was conducted, the question paper. This is the recent question paper. So if you want, you can just note down the questions. Okay. Okay. Can you see the screen?
Yes.
Okay. So this is the pattern of your question paper. GNM theory examination, January 2025. This is the latest one. So just to take the screenshot or otherwise write down the notes. So first of all, earlier we are discussed about, we are going to write the first exam, your paper 1, that is about the bioscience, that include not only anatomy, it include anatomy, physiology and microbiology. Okay, anatomy, physiology and microbiology are included in the subject bioscience. So total duration of the exam is 3 hours. Mostly it will be conducted in the morning or afternoon, and the maximum mark is 75. Okay. So next I'm going to talk about what are the questions, what type of questions you can expect from your question paper. Actually, this is the recent one. So we can expect the same type question paper in your this. I think in next month, someone have the supplementary exam, or otherwise who are the exam they have in the next session, they can expect the questions from the same pattern. So the first type of question, that is give the meaning of the following. Okay, give the meaning of the following. So this is one type of question. So another type of question is filling the blanks. Okay. Next type of question, that is about the filling the blanks. Next type of question, write short note on any 4 of the following. Any 4 of the following means total 5 questions are there. In those 5 questions, you should write 4 questions. Okay, I saw that some of the students, they will write 5 answers. No need to write this 5 answer. That will take your time. Just to write 4 answers. Next is answer the following. Answer the following. This session we can consider as an essay. Okay, answer the following session we can consider as an essay. Next is state whether the following statement is true or false, which is very easy, true or false questions. Okay, next is write short notes for any 4 of the following. This type of question, total 4 plus 4, 8 questions are there. Next is answer the following. So this type of question we can expect from your question paper. Okay, the first one is give the meaning of the following. And see here 4 questions are there. Each questions that carries 1 mark, and 4 plus 4 into 4, total 4 mark you can gain from this session. So here the question is adduction, second question is fertilization, third one cytology, fourth one is immunity. So how to write the answer? Okay, so that is the main question here. Here, give the meaning of the following, and we know that one right answer that carries only 1 mark. So explanation is not necessary. When you get a question like adduction, you just write the definition of adduction and 1 or 2 example of adduction. Okay, what do you mean by adduction? Adduction. Adduction
Adduction
means
is
it is
away from the moment. Away from the
away or
moment.
towards. Away or towards. Just step back and go to Google, search it. Adduction and abduction. Don't be confused with that. Adduction is the movement towards the midline. Okay, adduction. So we can just add some of the example also. Means example, hip skews the legs together. Adduction of the hip skews the legs together. It is an example. Actually, in our application, in Nursing Guru application, complete notes are there. That is very easy for the students. They can learn very easily, and also we are added the images. So if you are seeing or if you are studying an area with images or a video, it definitely will help you to remember that one. So just if you are not using Nursing Guru app, just download from the Play Store, and 999, only 999 is rupees for the 6 months. So you can just study from that. And in the first unit that is talking about this adduction and the different terminology, you can see the pictures also. Okay. So next. So in the means first question is adduction. So how many sentences? Yes, how many sentences you need to add like an answer? Maximum 2 sentences. One or two sentences is needed. Okay. Explanation never it is needed, because I saw that when we are doing the exam evaluation, some of the students they are very familiar with adduction. They will write like essay. What is adduction? Examples, everything. But actually it carries 1 mark. Okay, so for 1 mark question, you should write one sentence or maximum 2 sentences. Within that, you should ventilate what it is mean. Okay, so next question, what is that? Fertilization. What is fertilization? Fertilization. I know everyone, they're familiar with this terminologies, but now we are not ready to speak. Okay, no problem. Fertilization. We know what is fertilization. So when they explain about this fertilization within one or two sentences. Cytology, that is the study. Okay, cytology, that is also you can explain. Immunology, immunity. That immunity is from which topic? It is from anatomy, physiology, or microbiology. From which subject immunity?
Microbiology.
Yes, correct. Microbiology, because bioscience that carries not only anatomy, it carry anatomy, physiology, microbiology area. So one question that is from the microbiology. In microbiology, mostly you can expect this question just to write out definitely 100% guarantee. You will get a sum of question like this: immunity, sterilization, autoclaving, cold chain. Okay. So next is filling the blanks. In filling the blanks questions is there. Total 4 questions is there. What we need to do? We need to fill the area. The fifth question, dash is known as master gland. Dash is
Liver.
known as master gland. Yes?
Liver.
Master gland. The fifth question. I think you are moving with the sixth question. Fifth question.
Pituitary gland.
Yes. Okay. Any other suggestions?
Pituitary gland.
Adrenal gland.
Okay. Another?
Pituitary
It
gland.
is pituitary gland.
Okay.
Pituitary gland.
So 2 options are there: pituitary gland and adrenal gland. Pituitary gland, how many percentage? I think 90% people are talking about pituitary gland. So we can confirm with the pituitary gland. Yes, that is the right one. Pituitary gland is known as master gland. So how to write the answer? That is the question. So here 2 options are there. I will show that. I will show you. Okay. So here the 5th question is that dash is known as master gland. Here, 2 answers I written here. First is only pituitary gland. Second one, pituitary gland is known as master gland because I feel that area, and I again rewritten the question also. Which is the right one?
Pituitary gland.
Okay, means the first one.
Yes, first one is the right answer.
Okay. Actually, these 2 answers are right, but you can write in the way we are written in the first. Just to write the name, pituitary gland. Again, it is not mandatory to write the question. Okay, because if you are again writing the question means you lost your time. So that is the reason just to write the answer. Clear?
Okay.
Okay. Again, going to the next type of question. Okay, 6th one. Just we can ask. Dash is the longest and strongest bone in the human body.
Femur.
Fever.
Femur or thigh bone. That is the longest and the strongest bone in the human body. Other than this question paper discussion, I would like to tell one thing, because now it's time is 5:55. I don't know how much we can take the classes. It may be 1 hour. If it is 1 hour means when it is comes to 6 o'clock, automatically it will disconnect. No, don't worry. Next time we can continue the same classes. But how many time they are allowing, up to that time we can continue the classes. No issue. Okay. So when it is discontinued, don't be panicked. Next is the 7th question. Dash is the best method of sterilization. Actually, this is an area from the microbiology.
Autoclaving.
Autoclave.
Autoclave.
You studied everything. You know everything. Already studied microbiology, anatomy, physiology. That is the right one. I'm happy to hear that. So autoclaving, that is the best method of sterilization. And also this autoclaving and sterilization, you may get like a 1-word question, like a give the meaning of the following. So remember about autoclaving and sterilization. Next is the middle layer of the heart is called dash. Heart have total 3 layers.
Myocardium.
Myocardium.
Okay, myocardium. This was the right one. Okay, so in heart have total 3 layers. Which are the 3 layers? Myocardium. Cardium. Yes,
Inner
that is the
layer,
right
outer
one.
layer, middle layer.
Middle layer, outer layer, and the inner layer. So the name of the middle layer, it is known as myocardium. Outer layer, that is known as epicardium or otherwise pericardium. Okay. Then the innermost layer, that is known as endocardium. So just remember that the layers of the heart, that are 3 layers: epicardium, myocardium, endocardium.
Endocardium.
Correct. Okay, so simply you learn that. I will give one more option, one more thing here. That is the layers of uterus. Layer of uterus. Total 3 layers is there for uterus. The middle layer is known as myometrium. So innermost layer, endometrium.
Perimetrium.
Perimetrium. That is correct. So the layer of the heart and the layer of the uterus you are studying. Epicardium, myocardium, endocardium.
Endocardium.
Next, layer of the uterus, perimetrium,
Perimetrium.
myometrium, endometrium. Yes, it is very simple. Okay. So this layers. So we learn the layer of hearts and the layers of uterus. Okay, next is write a short note for any 4 of the following. So I told that here total 5 questions are there. So read the 5 questions and find which is the E1 and write that one. Select the 4 and write very neatly. Here the first question is about structure of heart. So you should write a heading about heart, and after that draw the neat and labeled diagram of heart. Then you can label some of the important area and give some explanation about that. Next is functions of the heart. That is enough because this is the 4-mark question. Next is ball and socket of joints. Ball and socket of joint. This is from the skeletal system. Ball and socket type of joints. Example.
Knee joint.
Okay.
Joint.
So here it is in ball and socket type of joint. Very simple diagram is there. A simple diagram is there, so you can just draw the diagram, and the diagram, the most simple diagram, it is available in our application. So you can just open the application and you can find that one. So ball and socket joint, that is an important question. If you draw the structure and you draw some of the labeled some of the area, means definitely you will get a 2 mark. Then give some of the functions. Okay. Next is the structure of brain. So structure of the brain, that is from the sensory system. Okay. So the structure of the brain, that is important. Nosocomial infection and classification of hypersensitivity. This both question from the microbiology. What do you mean by nosocomial infection? Yeah, it will occur from the hospital. So this is the examples of short note. Okay. Next is answer the following. This answer the following question we are considered as an essay question. The 14 and the 15 question, they have a connection. 16 and 17 question, they have a connection. Okay. So what is the 14th question? List the organs of excretory system, and 15 explain detail regarding the formation and the composition of urine. This formation and the composition of urine is a part of physiology, not from anatomy. The formation of urine. Okay, so the formation of urine, that is a part of physiology. But the list the organs of excretory system from anatomy. Next is Okay. Next is list the muscles of the head and neck. That question from the muscular system and explain the functions of the muscle. Means you can list down what is the function 1, 2, 3, 4. And when you get a question like that, explain the function. Don't like as a paragraph. Just to write the points. So if you are writing as like a paragraph in the right answer, same like you are writing as like a points, definitely you will get a more score in the session of listing down. Okay, because when you are listing down the functions of the muscle, definitely the examiner can easily identify, okay, these are the functions, everything the students is written and they will give the mark. And also here, just to check with the answers, for the first question, they will carry only 3 marks. The second question, that carry 5 marks, total 8 marks. Clear?
Yeah, okay.
Okay, next is state whether the following statement they are true or false. This is true or false question. Here you can write answer like a true or otherwise a false. Okay, so this answering also we can done within 4 or 5 minutes. Sorry, within 1 minute. Okay, this one. State whether the following statement is true or false. Why this one moving like this? Okay, so 18th question. The spinal cord. Okay, the spinal cord lies outside the vertebral column. Is it true or false?
True.
True.
True. Spinal cord lies outside, not inside, outside the vertebral column.
False. False.
False.
Okay. Anyway, I am not giving the answer. You can, after the class, just search in Google and find out it is true or false. Next question, 19th one. Progesterone is hormone produced by corpus luteum. Is it true or false?
True.
True. Any other suggestions? True or false? If you are saying true means just put a thumbs up.
False.
No one? True or false? Actually, progesterone is a hormone produced by corpus luteum. It's the right answer. Next question. Mandible bone is the only movable bone.
True.
True. Okay. Yes. Correct. Next is 21. Autoclaving is a method of disinfection. Same
True.
question is.
True.
Anyone have answer like to false?
No.
No. Anyone? No. If it is no, means just say false. False. Yes. Yes, it is false. Because autoclaving is the method of sterilization. You see? Autoclaving, it is not a method of disinfection. Autoclaving is a method of sterilization. What is the difference between sterilization and disinfection? Actually, this is a portion from microbiology. We can take a next class. But I will tell you the difference between disinfection and sterilization means sterilization that will be destruct all the microorganisms, including their spore. Spore means everyone know that spore. So the sterilization means the complete destruction of the microorganism, including the spore. Disinfection means what do you mean disinfect? Disinfection, that is the destruction of the bacteria, then but not include the spore. Okay, that is the difference between disinfection and sterilization. Maybe you will get a question like that also. Okay, next is write the short note for any four of the following. Same like the previous one we have discussed here, asked about the functions, mostly from the physiology. They are asking question. One question from the microbiology, that is classification of bacteria. Functions of the liver, you can list down the function. Blood group, what are the blood group that you can write? Menstrual cycle, one image also is there, one picture also is there. So you just remember the menstrual cycle and explain with the picture. Okay, next cranial nerve. Total how many cranial nerve we have?
The nerve including cranial cavity.
Cranial nerves, the number of cranial nerves? Have you heard about optic nerve, olfactory nerve?
Man.
Yes. So the cranial nerve also is an important one. Just to study the name of the cranial nerves. Okay, classification of bacteria from the microbiology session. Answer the following, same like the previous one. It is a short answer question. So one question that carry the 4 mark and total one question that carry the 3 mark and total 4 question is there and overall 7 mark. So this is an example of a question paper. Okay, I hope it is clear. Okay. So today's session we discussed regarding the basic revision of anatomy and physiology session for the GNM students and one paper discussion about the bioscience. I hope it is clear. Anyone have any doubt? Just unmute and talk to me.
Ma'am, one question is there.
Okay.
So they're asking diagram, no? So we need to explain that also.
No. Just if they are asking diagram means draw the diagram and label the part. That is enough. But it is a formal question or a shorthand question means you need to explain the function and everything. Just simply they are asking the structure of one particular organ or a means like the structure of heart means just to draw the structure of heart and label the part. But don't forget to label that.
Okay.
Any other questions? Okay, any doubt means you can message to us. And also one more thing, weekly we will conduct the live sessions. Actually, this is the free live classes. And the timetable that will be available in our official social media platform, including our Instagram page and the YouTube channel. So just check with our Instagram account and YouTube channel. If you are interested, you can follow our Instagram page and subscribe to YouTube channel. Same like the information you will get like a notification through our application. Okay, so and our live classes, every live classes will be conducted by different teachers. In the next class will be conducted by one of our sir. Sir is also a subject expert. Mostly the next class is next Saturday, that is about the fundamentals of nursing. Practice sessions also is there, so that class also it is very important. Don't miss the class. So and one more thing, you can learn. Okay, you can learn from the Nursing Guru and you can just view and study from the YouTube videos, and you can trust us from the live classes because it is us, the nurses, and the nurses are created for the nursing students. It is not from other persons. Completely, our application and our classes will be conducted by the nurses, so you can trust us. Any doubt, if you felt any time, you can just message to us. Our mail ID is there. At the same time, our WhatsApp number is there. And if anyone need any assistance means, you can just message through our WhatsApp number. We will give the complete assistance. Okay. Okay, I hope the class is useful for everyone. If it is useful, don't forget to share with your friends and just try to participate in the upcoming sessions also. Thank you so much for your careful attention and your valuable time with us.
Thank you
Bye
so
bye.
much.
Thank you.
Now it's time to wind up the section. Thank you so much.